In the second part of how to support residents with their daily mouth care, we will explore how to address issues in the mouth and techniques to try when mouth care is difficult. Some ways to help when mouth care is difficult. Communication is important. Be friendly, explain clearly, reassure and be positive. Break down the task. Consider cleaning the mouth in smaller sections and repeat this through the day. Remember to keep a record of what has been cleaned. Describe and show the toothbrush to the resident. Mimic brushing your own teeth. Give a spare toothbrush to the resident and the resident may mirror your behaviour and brush their own teeth. It may be helpful to have more than one care assistant, one to support and distract and the other to clean the mouth. Come down to eye level. Be aware of personal space. Be willing to slow down or try again later. Chaining. This involves gently bringing the resident's hand to the mouth while describing the activity. Let the resident continue if they are able. If chaining is not successful, then place your hand over the resident's hand and gently brush the teeth together. If none of these strategies work, then try distracting the resident. Find out what works. It could be music, talking, or having another object to hold. Or consider trying at a different time of day. If all attempts fail, keep accurate records of all the attempts made, and consider alerting the resident's family. The resident should agree to this if they have capacity to consent. Residents with dementia may not be able to tell you if they are in pain, so a reluctance to have their mouth cleaned may mean that there is an area that feels sore. Guide or prompt them and break down tasks into easily manageable steps. If they don't seem to be coping, reduce any demands on them. Pause and reassess. People with dementia have good days and bad days, so try to find out the individual's best time of day for mouth care. Communication strategies are vital. Be caring, calm and smile. Use eye contact and encourage them to look at you. Talk clearly, at the resident's pace, giving the resident your full attention while they speak. Use reassuring and appropriate body contact and gentle touch. Remain positive and try to refrain from showing any frustration. Distressed or distressing behaviour represents an unmet need. Try to understand this unmet need and acknowledge the feelings behind it. Listen carefully and look for visual clues. Give reassurance. Use distraction. In early dementia, the resident will usually still be able to clean their own teeth, but they may need to be reminded to do this and given the toothbrush and toothpaste. If necessary, show them what to do and support them to maintain their independence. As the dementia progresses, the resident may lose the ability to clean their teeth or lose interest in doing so, and carers may need to take over this task. Some useful tips for mouth care. Cover the mirror, as an individual with dementia can be alarmed by their own reflection. If possible, clean teeth in the bathroom. The visual reminder helps them to know it is time to brush their teeth. Show pictures of someone cleaning their teeth. Try giving them the toothbrush with paste on and show them what to do. If they do not brush, then gently use the hand-over-hand technique and guide the brushing. This helps the individual feel more in control and retains their independence. Keep explaining and reassuring, and keep a record of what works. If a person refuses mouth care, and that resident has capacity to make that decision, then it is their right to make it. Explain why mouth care is important and the possible consequences of their choice. Personal care is an intimate activity, and many people will experience difficult feelings if they need help with this. Care-related stress and distress is how some people communicate their need to believe that they are still independent. For many with dementia, it is not a willful act to refuse care, but rather a sign of confusion and distress. If they lack capacity, then investigate why they are refusing. Some possible reasons might be that the resident does not understand what they are being asked to do, or they are refusing in order to keep a sense of control, or that they might be misinterpreting the situation or environment. They may be in pain, so look for any signs of soreness, infection, broken teeth, which could make mouth care uncomfortable. Come back and try again later, at another time of day when the person is calmer and more receptive. Try another carer with whom the person is more familiar. Explain carefully what you are going to do and why you are going to do it. Be patient, take your time and be reassuring. Document and report if the resident refuses mouth care, and if this becomes a frequent occurrence, then escalate this to your manager. Older people tend to produce less saliva, and a dry mouth is a common side effect with a number of medications. Having a dry mouth is uncomfortable, and it causes difficulty in eating, speaking and swallowing. It may be a reason a person cannot sleep or wakes in the night. The lack of saliva increases the risk of tooth decay and may make it difficult to wear dentures. Mouth care for a dry mouth. Encourage the resident to take regular sips of water. Use saliva substitutes or oral gels. There are a number of products designed to provide moisture and comfort, usually in the form of gels or sprays, and a dentist or pharmacist can give advice on these. Good quality olive oil can also be used to lubricate the mouth and lips. Increase frequency of mouth care to keep the mouth comfortable. When dry, the mouth becomes very sensitive, so always choose products that are mild and not strong tasting. In addition, try to avoid sugary food and drinks or those containing acid, such as colas, citrus fruit juices, biscuits, sweets and cakes. Cut down on things that dry the mouth, such as alcohol, caffeine and cigarettes. Use an air humidifier. This can be particularly helpful at night. Reassess the mouth regularly and consider seeking professional advice. Caring for the mouth is important if a person requires palliative care. If oral hygiene is neglected, the mouth can rapidly become dry and sore, so assess daily for any changes. The build-up of bacteria in the mouth can also increase the risk of mouth infections, so oral care is important. Symptoms in the mouth are common, and these may include a dry mouth, a painful mouth, halitosis or bad breath, alteration of taste and excessive salivation. Please see more information on these in the toolkit and seek professional advice if concerned. Try to keep the resident comfortable and consider if mouth care could be carried out by family members, giving them greater involvement in the care of their relatives. Mouth care should be provided at least 4 times a day, after each meal and at bedtime, to gently remove coatings, debris and plaque from teeth, gums and soft tissues. Use fluoride toothpaste on a small-headed soft toothbrush. Some people may need more frequent oral care. Clean dentures at least once daily and remove and store overnight. Regularly remove oral or dried secretions with gentle suctioning or a soft toothbrush. If the mouth is dry, apply water-based saliva replacement gels or hydrate the mouth with a soft toothbrush dipped in water or with a fine water spray or dropper. For people with swallowing problems, use non-foaming toothpaste and ideally a suction toothbrush. A word of caution about using mouthcare swabs with a foam head. There is a medical device alert on the use of these swabs, and it is the carer's responsibility to check that the sponge head is secure before using in the mouth, as when soaked it may come loose and could be aspirated. Foam swabs do not remove plaque from the tooth surface and should only be used to moisten the mouth or clean soft tissue surfaces. Avoid using lemon and glycerin swabs, as these can dry the mouth even further. In summary, promote independence, encourage and support the individual to perform their own mouth care. Remember to always consider the person's comfort, privacy and dignity when you deliver mouth care. Be prepared with everything ready before you start, and always explain to the resident what you are doing. Work with the resident and review their needs to adapt their mouth care to get the most effective clean. Perhaps consider cleaning the mouth in smaller sections more frequently through the day. And remember to record what care has been provided and refer to a dentist if you are concerned about anything you find in the mouth.